Hi, I'm Linda Olley. I'm a registered nurse. I'd like to share with you today my own personal story of living with Lyme disease. I awakened one morning in 1984 with multiple symptoms that included a stiff neck, a temperature of 103, a migraine headache, chills, sore throat. I literally was not able to lift my head off the pillow. I was so ill that my family doctor made a house call and chose to treat me with 10 to 12 days of antibiotics, feeling that I had the flu. And the antibiotics did allow me to feel better and resume my normal activities and a normal life until 3 months later, I began with many bizarre symptoms. Continuation of migraine headaches, muscle twitching all over my body, extreme insomnia, fatigue that was unrelenting, just a plethora of symptoms that continued to progress. I was finally diagnosed 9 years ago with Lyme disease. I saw probably 15 doctors, all ending with ologist, because my symptoms involved so many systems of my body. I had heart palpitations, my eyes were affected, my hearing was affected, my nerves were affected, my joints were affected, my brain, and no one was really able to identify exactly what it was, including the head of rheumatology at Hopkins, who said she didn't think this was rheumatoid arthritis. And I kept saying that I felt that it was Lyme disease because I have a history of probably well over 100 tick infestations from living at our summer cottage in the woods for so many years, but no one thought it was Lyme. And I thought I tested negative, and I guess I did based on the CDC, but I found out later that I did have a couple of positive bands, but I did not meet the rigid criteria established by the CDC. I advocated for myself because I always felt that I had Lyme disease, and the more I read and empowered myself with knowledge, the more I was determined to persevere, until finally I was led to see a Lyme literate medical doctor. Lyme literate meaning a physician who sees and treats a lot of Lyme disease and is current with the scientific evidence and the research about Lyme and tick-borne diseases. So it was not really until I saw a Lyme literate MD that I was able to get the appropriate treatment, which involved long-term antibiotics. It was finally believability that what I was experiencing was not in my mind, that it was actually a real disease. And yes, there was a sense of peace that, all right, I know what I have now, what am I going to do about it? And that's the question I'm still asking myself, what am I going to do about it? Because every day is different. And I embrace the challenges that each day brings to me. In all honesty, because I had a delay in treatment for 20 years, I did not see a significant difference with the antibiotic treatment, and symptoms continued to progress. So it was after a long period of time that I chose to stop antibiotic treatment and found a physician who treats more naturally with herbal preparations. And it's because I changed the protocol that I am beginning to finally see some improvement in the pain and my quality of life. I have a wonderful doctor that has allowed me to be an active participant in making responsible decisions about my own health and well-being. And again, as I stated earlier, I would not go to a doctor that I couldn't have a doctor-patient relationship where I was an equal partner. I have declined some medications that I've been not willing to take the risk, and other times I'm very open, and my doctor has just worked with me and listened very closely and honored and respected my wishes. And that's the way that a doctor-patient relationship should be. So finding the right doctor that knows the importance of treating long-term, using different treatment modalities, not just necessarily antibiotics, it is the key to a person's health and well-being, because had I been treated appropriately and diagnosed early, I would like to believe that I wouldn't have had 14 joint-related surgeries and 6 total joint replacements, and these surgeries began when I was 40 years old. The only thing that makes sense out of pain and suffering is to be able to find purpose and meaning for your suffering. So when I stopped my nursing career, when I ended it as a parish nurse after 16 years, it wasn't very long until God nudged me and said, you need to start a local support group, because we had none in the Harrisburg area. So I was led to start the support group in 2009, and it brought such meaning and purpose. And to this day, we have over 250 in our database, and we're growing in numbers each month that we meet. And if I may just share a moment where we meet the third Tuesday of every month at Country Meadows West Shore in Mechanicsburg from 7 to 9. And usually we bring in really wonderful speakers where people can be educated and learn how to advocate for themselves, which is a key. My best advice is to find a doctor that treats Lyme, a lot of Lyme patients, and the support groups throughout Pennsylvania can help connect people with the right doctors. I just want the public to be aware that there is help, there is hope, and to seek that, feeling that you're not a victim, that you're not going to give your power to the disease, because I am not my disease, and I am not going to let it control me. And therefore, I am not a victim. My hope comes from being so grounded in my faith. And hope comes for all of the people that are suffering in Pennsylvania. We have 18 wonderful support groups throughout the state of Pennsylvania, where all people have to do is just Google Lyme support groups, and they will come up by state and tell you the location of all the support groups, and people can go there to turn to a group of loving, caring, sensitive individuals who are dealing with all the manifestations of Lyme disease, and they can become educated and find hope and help in these support groups. I believe that there's no such thing as a hopeless situation, only people that grow hopeless about them.